Hospital for Tuesday, January 6th, 2026. I got to get used to saying that.
Right.
Now call a motion to adopt the minutes of the November 5th, 2025 meeting.
So moved.
Jose?
Second? Yes.
Dr. Katz?
Yes.
Sally?
Yes.
Anita, okay. Dr. Morton?
Yes.
Of course, we did that already. All in favor? Opposed? The minutes are adopted. So tonight we scheduled to present annual virtual reports. This evening are the following cabs: NYC Health and Hospital Carter, Health and Hospital East New York, Health and Hospital Kings County, Health and Hospital Queens. Is Queens in the house?
Yes, indeed.
Okay,
Yes,
okay.
indeed. We're traveling a little heavy this evening.
Very good. So I now turn this meeting over to Dr. Katz for his remarks. And let me say, I am so glad to turn this meeting over to Dr. Katz.
Oh, thank you so much, Madam Chair. You have the full report, and I like to spend as much time hearing from people, not me reading the report. So I'm just going to hit some of the highlights. That Lincoln received national recognition by the American Council College of Surgeons for the great job, that Metropolitan gave out 1,000 toys to children and families. We hosted Columbia University students for discussion on public health leadership. We're working aggressively to enforce laws to prevent driving while intoxicated. Queens, who was traveling heavy here, we're happy to got national recognition for their excellence in surgical safety. Jacoby received $25,000 to Stand Up to Violence program. Remember, Madam Chair, when we were all together at Harlem?
Absolutely.
With the consolidation and collaboration of the different programs that stand up to violence. We got $750,000 from Borough President Gibson and Deputy Speaker Ayala for improvements to Belvis. Bellevue hosted infection prevention nurses from South Korea as part of a training exchange. Our show vans, which are out there providing care to people who are homeless through vans, distributed over 14,000 clothing items. We are partnering with the consulates to promote healthcare access and blood pressure measurements. Queens was named, also glad that Queens is here because they've done so many good things. They were named Lung Cancer Screening Center of Excellence. They received $1 million, yes, from the president of Queens for an advanced surgical microscope equipment. South Brooklyn was recognized for the highest quality stroke care. Bellevue School of Radiology Technology celebrated its 51st graduating class. Elmhurst got its designation as a Center of Excellence in Lung Cancer Screening. Metropolitan achieved central line associated bloodstream infection rate of 0. Boy, that's going to be hard to improve on. We're collaborating with Taiwan Centers for Disease Control on preparedness. And 5 of our health systems were named to U.S. News and World Report. One of our anesthesiologists was named to Crane's Notable Leaders in Sustainability, and a local Brooklyn artist, Eddie Kwan, photo exhibits debuted at South Brooklyn Health. We appointed Selwina Brewster, who many people know as the Chief Medical Officer. She's wonderful at South Brooklyn Health. And we celebrated World AIDS Day here in New York to remind people of the resources available. Madam Chair, I'm always happy that there's so many phenomenal things going on at health and hospitals. I'm
Absolutely.
happy to have the honor to report on them and happy to answer any questions.
Thank you, Doctor. Any questions for the doctor? Hearing none, I want to thank you, Dr. Katz. We will now hear from the four facilities presenting their verbal annual report. Each presentation is allotted, I know it's 2026. What is it, each presentation allotted? 5 minutes. Yes, nothing changed for 2026, and it's all good. And we are grateful. We are so, so grateful for the report that Dr. Katz give us every quarter. The work that went into preparing them, we're grateful. Thank you in advance to all our speakers, your time and commitment to this system. And just let me say, we really appreciate it. As a board, we come here, and it's just not to hear all the good things, but to feel the good things. When y'all present, we really feel it. And that's what's good about this committee. We feel it. So thank you in advance. So now I'm going to call, I see him all over there smiling.
We're ready.
Hello, Mr. Carter. I call him Mr. Carter because he runs Carter now. Thank you so much. I call now Miss Marie Charles,
Thank you. Thank you very much.
and she's our CAB member.
Yes,
Okay.
CAB member. Good evening, everyone. My name is Marie Charles, and I am a member of the Community Advisory Board at New York City Health and Hospital Carter. Today, I am going to share our progress and initiatives that highlight our ongoing commitment to enhancing our facility and our community. We're going to move to slide number 2, which is equipment and infrastructure. Thank you. So this year, we will expand the nursing facilities ventilator capacity. Residents will be temporarily relocated to the long-term acute care hospital during the expansion to ensure continuity of staffing and services for residents. During the past year, Carter also acquired new feeding and IV pumps and installed a gym for all staff members based on employee feedback and surveys. For this dose pharmaceuticals, we also eliminated Pyxis and replaced it with Omnicell medication management systems. Slide number 3, patient safety and satisfaction. So patient safety and satisfaction remains a top priority for leadership, CAB, and staff, as evident by recent press Gainey patient and resident surveys. Carter is honored to be listed as one of the best nursing homes by US News and World Report for short-term rehabilitation, and elated to have received acknowledgement for our long-term care in 2026. In the nursing home, Carter was named to Newsweek magazine's Best Nursing Homes list, ranking number 4 out of over 600 nursing homes in New York State. In October 2025, Carter Nursing Facility completed a successful New York State DOH Article 28 Nursing Facility Survey. We are proud to report the 6-day clinical and 1-day environmental surveys produced no deficiencies. Carter received the American Nurses Credentialing Center Clinical Pathway to Excellence with distinction. The designation was awarded in 2025. However, it was a 24-month organizational journey to achieve. Carter became the first post-acute care organization in the country and the second health hospital's facility to receive the coveted with distinction. Slide number 4, frequent complaints by patients and residents. Overall, patient resident complaints remained low during the past year, and analysis identified the most common issues are attitude, courtesy. To address staff attitude, courtesy, I care with kindness trainings and pledges are ongoing, as well as an increase in staff engagement and wellness activities. Delay of care, to address the delay of care, care plans will continue to be modified based on patient, resident preference in care. Slide number 5, please. Thank you. We continue to fulfill the health hospital mission by providing uncompensated care to those who are not eligible for public benefits. Carter's nursing aid training program continues to go well. Since the program's inception in January 2022 to date, there have been 92 candidates. One of the 92 candidates, 42 are currently working on the units. The program received state recertification until 2027 and remains open to the community. During 2025, the CAB officially welcomed 2 new members. We also partnered with New York State Senator Edward Gibbs in donating school supplies and book bags to local schools and participated in Senior Day and Afro Latino events sponsored by New York State Senator Cordell Clear. So diabetes and high blood pressure continues to maintain a high prevalence in the East Harlem community. We are committed to continuous outreach through health screenings to address these issues. Slide number 6. We would like to extend our gratitude and acknowledgments to our clinical and operational leadership and our elected officials and strategic partners who help to amplify the impact of our work. That concludes my presentation. I'd be happy to open the floor for any questions you might have. Thank you.
Thank you. Any questions, Mr. Chair?
Just more a comment on, I like how you put in the report staff wellness as being critical and mention a few examples of what you do. So I'm sure that's connected to being number 4 out of 600 and all of that. So congratulations.
First thing, I'd go to the gym. Very
Have a
convenient.
gym and then all
Okay.
the survey data collected on it. So.
Dr. Cat?
I think all the wonderful work that's done at Carter, I really appreciate it. Thank you.
Sally?
Yeah, your work with diabetes and high blood pressure in the community, the outreach you discussed. Could you talk a little bit about that outreach?
Sure, if I could assist in the discussion. We have made it a point of emphasis to have community outreach, specifically in the East Harlem community and the Greater Harlem community. We've teamed up with a combination, as discussed, as presented, Senator Cordell Clare and Representative Gibbs in some of their initiatives. Also, some of the other nonprofits in the area, El Barrio, and a few others. We try our best to participate whenever they're having different events and activities to serve as the representative for health and wellness. So blood pressure screenings, some different checks, some education around that. We've been able to play a role in those different fairs, street fairs, wellness programs that they have. And it really, I'll say, helps us to have a presence in the community. Right now, we're literally just getting the outpatient off the ground. So we want to make ourselves known to the community and what services we have to offer and participating in the wellness, currently working with the diabetes and other screenings that helps.
That's great. Thank you.
Dr. Morgan?
Thank you for your wonderful report.
Thank you.
Need it?
Thank you for the report. I was glad to see that the number one on the community impact was providing care to those who aren't eligible for other public benefits. Do you have any metrics on that, like how many patients have been served, how many hours the healthcare practitioners have spent?
We don't have the specifics on the um, for individual providers. Our affiliation is with NYU School of Medicine, and it's not based on, I guess I'll use the compensation. It's not based on RUVs or anything like that. So uh, we don't keep track of the hours that they actually serve in treatment. What we try our best to do is to work within health and hospitals to provide the care and services based on the need and providing that continuum of care. Most of our cases will come from our health and hospital system. And at the present time and over this calendar year, and I'll say consistently throughout our time at Carter, we average anywhere from 13 to 17% uncompensated in our percentage of overall care. So I don't have the actual numbers, if you will, but just knowing that it's our goal to remain in the 13 to 17% window.
Great, thank you.
Thank you. And just let me say, keep up the good work.
Thank
Just
you.
keep up the good work.
Thank you.
East New York is in the house. Miss Crystal Matthews, Cab Chair.
Thank you.
Okay.
Good evening, everyone. My name is Crystal Matthews. I'm the chair of the Community Advisory Board at East New York. I'm joined tonight by Charmaine Roach Valentine, our Regional Director of Ambulatory Care Services. Today, I'm going to share our progress and initiatives that highlight our ongoing commitment to enhancing our facility and our community. We are continuously working to improve our infrastructure and equipment at East New York. This year, we will be upgrading our bathroom to be ADA compliant and upgrading our DEXA and IDF IT closets. We'll also be kicking off a facility-wide comprehensive energy project and will be working to renovate our women's health and pediatric units in addition to our optometry unit. We are happy to share that we have completed integrating primary care into behavioral health last year. Next slide, please.
Third.
We face some staffing challenges at our facility due to a number of reasons, such as a loss of primary care providers, which makes it take longer for patients to receive an appointment. And there's also been an uptick in patient walk ins due to seasonal illnesses. Site leadership is working with HR to interview qualified candidates to fill all vacancies. We also received complaints about unanswered phones. We offer patients the option to call the centralized call center and are having staff check voicemail twice a day to retrieve messages and address concerns. Lastly, we are providing staff with regular communication training to ensure they are equipped to engage with patients effectively, handle difficult situations, and provide clear instructions to patients and colleagues. Next slide, please. We continue to use eye care with kindness as a strategic priority that aims to infuse our health system's culture with more kindness. We aim to ensure that all employees take the pledge to ensure that all staff uphold the eye care values. We also engage in weekly rounding to ensure clinic safety and patient satisfaction to address issues in real time. Real-time service recovery is our goal to mitigate any potential issues as well as obtain real-time feedback. Next slide, please. East New York holistically assists patients in navigating their health journey despite social determinants of health and cultural differences in the community. We have received multiple designations and ratings from the American Medical Association and Health First for our diabetes, hypertension, cancer screenings, and eye exam services. We also work closely with our patients to provide holistic, culturally and socially sensitive treatments to our patients with obesity. Next slide, please. We would like to extend our gratitude and acknowledgments to our clinical and operational leadership and our elected officials for their tireless commitment to serving the health care needs of our Brooklyn community. This concludes my report. I welcome any questions or comments at this time.
Well, thank you so very much. You really did it. You got, you know. Mr. Chair?
Nice report. I like the integration of primary care into behavioral health that you mentioned. Or was it the other way around? I think I said it right.
Yes, you did.
Dr. Katz?
Thank you for the report. I wanted for the board more as a general issue to expand a little bit on what you said about the phone system, because I had my own positive experience this week with my developmentally disabled sister, who I'm the contact for. So I received a message. I couldn't, she had an appointment. I couldn't tell. The message said to call the nurse. The phone number, appropriately, and I appreciated this, was the call center. I returned the call to the call center. I didn't know it was the call center till they answered. But true to a well-functioning call center, the call was answered pretty much instantaneously, like pretty much like the second it rang. I got a real person. I explained the problem. She was very clear. She said, I'm not at Goof. I'm at the call center. But what I can do is I can send a message to the nurse at Goof and tell them what your question is and have them get back to you. And then I got a call back from Goof to explain what it was my sister had to do. And the reason I'm going through it a little bit is that in the old system, whereby we have a zillion phone numbers, some of whom are right, some of whom are wrong. Sometimes there's someone to answer it. Sometimes there's not somebody to answer it. It's a guarantee that people are going to be dissatisfied and feel uncared about, because you call a center and nobody answers. What are you going to think other than that nobody cares
That's right.
about
That's
your
right.
concern?
That's right.
But there just is no real way that we're ever going to succeed, that every phone is going to have somebody sitting next to it ready to answer, because it's always going to turn out it's a patient over here, someone has to take her to the bathroom, what are we going to do, there's no wheelchair, could you please go and get a wheelchair? I mean, that's real life, right?
Yeah.
But having a call center, and the call center, what they could do is they can find my sister on the system, they can figure out where she has to go, and they have all of the internal numbers, so and they can use Epic text system, so they can also text the people, right? So they have a whole set, and for most people, including me, I called at 9. I needed an answer before 1, which was when my sister's appointment was. But I didn't need an answer that minute. I just needed an answer before 1 o'clock, and I got the answer at 11:30, which was perfectly fine. Right. And so imagine instead you call and it so happens that the person is out that day. Right. And then nobody calls you back. Right. And so, I really think that the call center, and the other thing I like about the call center, you can check to see if people are being polite. You can find out how quickly you respond. You find out, you have very explicit data on what you can train people to handle different levels of call. You can up triage. And so one of my quests is for there to be no phone numbers in health and hospital other than the call center. Because that's the only way I feel I can be certain that every single person who calls, and of course it's multilingual, right, which is another issue, that yes, we have translation, but the person who is going to pick up the phone doesn't yet know what language you're speaking, right? So that's yet a different problem. Yes, they can call you back with the translator, but the call center can do it immediately, right? Because you can choose your language on the call center. So, my goal, that is my goal, is all calls through the call center All communications are internal. Everything also is documented. You don't have any issue if someone says, I called 3 times, and then the other person says, I never heard from them. And then like, how do you resolve that kind of consumer? Everything's documented. We know every call, everything. It can be traced. So I think that we have to do a little bit of teaching because everybody has these old numbers, some of which are disconnected, right? But I think to the extent that we, get the message to everybody, call the call center. Let them do the legwork. Don't be on the phone all morning, frustrated that you were waiting for a call you never got back. Also, they called me back on my cell phone, right? I gave them, what number do you want the message to come back? And they clearly relayed that to the person who had to call me because it came on my phone, my cell phone, not the number that's listed under the record. So I felt really happy with that experience.
I called to make an appointment at Bellevue, and it was like first-class service. It was amazing.
Through the call
Through
center.
the call.
But if you had called that clinic in Bellevue, who can do spectacular work, amazing medical care, amazing nursing care, answer the phone.
Answer the phone.
Yeah, it was
Perhaps
terrific.
not.
They just were putting the courteous and anxious to please and making sure I got to the right place, and it was terrific. I was so impressed.
Good. Sally?
Anything about the report?
No.
Doctor?
I love the fact that you mentioned cultural sensitivity with obesity, because to me that is very important. Why a lot of people don't stick with plans is a lot of times it's like, I don't even eat the stuff they're telling me to eat. So I really love that, and I would love to hear more about that in the future.
Anita?
I too noticed that about the obesity, and I'm glad Mitch and Sally had such great experiences with the call center, because I would never have guessed that was an issue. But that was a way to solve the issue so well. So congratulations on that work.
Yes, congratulations to you. Keep up the good work. And I'm glad that the doctor opened up that subject, that, the presentation y'all mentioned, because it's so true. So we are sitting here and we are the board and the doctor is our president. So let's get it done. Okay? Let's go. So now we have the famous Kings County.
Good evening, everyone.
This Miss Chen.
Yes, it is.
All right.
I am the chair for the Kings County Community Advisory Board, and I'm going to be sharing some of the progresses and initiatives that highlights our ongoing commitment enhancing our facility and our community. At NYC 8 Health and Hospital Kings, we're committed to delivering high-quality care that meets the evolving needs of the Brooklyn community. We have completed a number of renovation projects, such as the P Building exterior, D Building pharmacy Omnicell, and the S Building sterile pharmacy renovations. A number of projects are in progress as well, such as the E Building elevators renovation, ambulatory surgery center, radiology suite, and the emergency department observation unit expansion. We will be adding a third surgical robot this year, and we have replaced 350 inpatient beds and about 1,800 infusion pumps. We are very proud to share that we had a 60% reduction in non-emergency medical transport costs, generating a savings of $513,000 in 2024. We also had an 87% reduction in central line, the CLABSI events, and 94% reduction in CAUTI events, the catheter-associated urinary tract infections. We are focused on building on our culture of safety and hope to reduce fall injury rates through targeted prevention strategies, and will work to improve HCAHPS scores to meet and exceed NYS performance. We also received a stroke and heart failure Gold Plus designations and resuscitation Gold. We received recertification as an advanced thrombectomy capable stroke center and level 1 trauma center. In regards to the patient satisfactions, the top categories for complaints and grievances were care communication, patient safety, attitude, wait times, and lost property. The number of complaints and grievances has declined steadily since patient-guest relations has taken a more proactive role through robust rounding practices. We received 99,700 interpretation requests and have a 99.6% fulfillment rate. The main areas of focus for improvement in patient satisfaction scores are nurse and doctor communication, staff responsiveness, and communication about medication and discharges. Patient concerns and issues impacting the community. The community we serve faces many challenges, including wait times for appointments in the ambulatory care practice, the availability of affordable housing, community safe concerns in the hospital's catchment areas, and the need for expansion of the emergency department space to meet the increasing patient demand. The community is also concerned about declining access to public benefits, food assistance programs, and healthcare services. The facility has implemented initiatives to address these patient concerns. Most issues stem from a single root cause, lack of space. To address this, we're initiating a study to optimize examination room utilization in ambulatory care practice and planning projects to expand the emergency department observation area and trauma bay. Emergency department wait times are being addressed through quality improvement initiatives to reduce the patients leaving without being seen. I had mentioned before the pivot on the triage parallel processing. The facility initiative to address patient concern continues as it relates to the property management. Through enhanced bedside reconciliation of clothing, bag labeling, and documentation, as well as significant improvement to back-end processes. The room is now organized, alphabetized, and consistently maintained. The impact. We have many programs at Kings County impacting the community, and this is just to name a few. The head cooling blankets have been implemented, eliminating the need to transport NICU babies to other facilities. Generally, that's done to Bellevue. The extension of pediatric behavioral health clinic hours facilitates access for working families. That's now extended to 7 to 8 p.m. And they're looking to do so on Saturdays also. We receive recertification as an American College of Surgeons verified level 1 trauma center and were designated as a center of excellence in lung cancer screening. In behavioral health, we have the critical time intervention team, which works with the community following the CPEP or inpatient stay to ensure patients with serious mental illness are connected to ongoing care, reduce their readmissions, and support safe transitions back into the community. I would like to, for their ongoing support for expanding and enhancing access to person-centered care, treatment, and services provided to the patients and staff at Kings County. Our special thanks and gratitude are extended to the Community Advisory Board, Office of Communication and Public Affairs, senior leadership at Kings County, and our elected officials. That ends my report. Thank you.
And thank you. Mr. Chair?
Just the focus on the patient experience is pretty impressive, and the fact that you see patients from all over the world and different languages and so on also. I was just looking at the number of minutes that you work on
Yes.
that. It's pretty impressive. Yeah. Thank you.
Dr. Katz?
I want you, feel free to use your lifeline, that excellent CEO sitting next to you. How did you make the savings on the non-emergency transport?
So we started looking at patients being discharged instead of being sent home in an ambulance or an ambulette. you can take an Uber.
Uh-huh.
And we said we were very strict about if the patient is ambulatory, they can ambulate out the building. They don't need to be on a stretcher being wheeled out the pool.
Not good for them. Better to take an Uber
Correct.
for them.
Correct. Yeah.
Yeah, I mean, we can also obviously use if the Medicaid system were, transport system were a little bit more functional, we probably could even save on the Uber, but my
Correct.
understanding is that it's just not. The other question was the food commodity program. We do that on behalf of the state?
Yes, so that is a state-funded initiative. It doesn't sit at the county, it sits in the community in East New York, and we distribute food across the 5 boroughs, actually.
That's great. And then the last thing, I'm so happy with the efforts that you're making around the kindness initiative and the eye care. Another one of my goals, besides eliminating all phone numbers, is to never see a complaint that says attitude. Right? That's just such, I mean, and we all know what that means. But it would be so easy to, right, compared to all the hard things Health and Hospital does, it seems like it would be so easy to not give attitude to sick people, right? It seems like it would be so easy, and yet it remains across all of our facilities and hospitals, outside of Health and Hospitals, right? And how to change that. But I think you've been doing good efforts. And I think that it's just something we have to keep working on to sort of change, right? It is better for all of us to be nice. It makes us feel better. Showing someone attitude, especially if they're old enough to be your grandmother and they're in a bed, is not a nice thing and not something that's going to make you feel good at night. Right. So I appreciate all the efforts that you've been doing at King's to try to really change that, and maybe someday the complaints will not include attitude.
Well, to counter that, we've gotten a major increase in compliments.
Yes, but not about attitude. Compliments about kindness, right? And people, making extra effort. Right, and again, I always go back to the fact that it's good for the person to be showing kindness. Right, forget how much therapy it is for the sick person, but showing attitude is not good for your own soul. So, very good, thank you.
Thank you, Dr. Sally.
Just a question. You do so much. What would you say might be the top 2 patient-facing things you're doing that have had the most positive receptivity by patients?
The work we're doing in the ED as it relates to reducing the walkout rate, the pivots. So we're bringing mid-levels to the point of entry at where triage is taking place, so they don't feel that they're waiting an inordinate amount of time. That's one. And the other is rounding with the staff to hear their concerns. And the question is always, who's more important, the patient or the staff? They're equal. Without staff engagement, we don't have good patient care. So staff really appreciate that we sit there and listen to their concerns. And we always start the conversation, there are some things that we can fix, and there's some things we can address immediately, and the other things that we can't. So let's focus on the things that we can fix.
Thank you.
Very good, Doctor.
When I heard about the Lost Property Initiative, I know that's a big issue, especially with the war room environment you have there at Kings County. How are you doing with canes, walkers, and dentures? Because those are like very big items.
So the biggest issue is actually dentures because they get wrapped up in bedding and so forth and get discarded, unfortunately. So we try to help our patients understand, put them in the receptacle at the bedside. But property was a major issue, and it's a constant issue. And we had to reinforce with the staff and with the families. They play a big part. Take as many things with you home. Don't leave them here at the hospital with us.
No, excellent.
Nita?
Great work. No further questions. Thank you for the report.
So just let me say, my comment is, I am so glad that the issues, and this is why this group is so important, that the issues are being raised of what's going out happening in the world of health. And you are the ones who make it happen so good. You really do. I could feel the love and caring. And doctor, you know why I really like you?
Right. I know it's not because I'm handsome.
You are handsome inside.
Inside. I accept that. I think I'm very handsome
That's
inside.
right,
It's just
inside.
outside
And
that's the problem.
No, you ain't got no problem now. But you know why? Because one of the reasons that I wanted to come on this board, I've been with health and hospital for 30 years. I started side as a CAP chair in the CAP. Because of the reasons that we're discussing, I said, Mr. Chair, I said, I used to, and I was faithful going to the meetings and hearing the calls and calling in. I said, no, I have to get on that board because we have to help somebody. And this is what we're hearing, right? We have to help somebody and make a difference. And I feel I could help make a difference. And after hearing doctor, when I got on here and learned the doctor, he really cares. See, people could get on stuff for titles and money, but he really cares. And it trickles down. We're like a family. It trickles down. And I even heard somebody say, I think this is one of the best years aboard, when y'all come. Because it's like a family and we're hearing the realness. We're not trying to push nothing under the carpet and ignore it. And that's why I said, yeah, whatever we could fix, let's get it done. And that's why I wanted to be on this board. Thank you,
Well, I'm
Doc.
so glad you're on this.
Yes, thank you so much. So now, saying that, Miss Queen over there, Miss Queens is the queen. Come on, Miss Hogan Robin.
Yes, yes, yes. I'm Robin Hogan. I am the chair of the Community Advisory Board at Queens Hospital. I am really honored to share with you the collective progress and the initiatives that demonstrate our commitment to enhancing the healthcare within the Queens community. Slide 1. Yeah, that should be it. Okay. I'm going to highlight our achievements and focus on our active projects, funding updates, patient satisfaction, and the challenges that we face while trying to move forward. Slide 2. Active projects and operational status. In 2025, we continue to enhance our hospital with several key infrastructure and equipment improvements. The completion of the PET CT replacement and the finalization of our interventional radiology renovations are significant milestones. The MRI suite renovation is underway, and campus lighting upgrades are progressing quite well. We are also working on the community retail pharmacy and pharmacy decanting. Additionally, our new dialysis training center and robotic operation room improvements will not only strengthen Queens Hospital's surgical leadership, but will also enable us to provide better care while controlling costs associated with delivering services. Slide 3. Funding, next step, and its impact. Our fiscal year of 2025 capital program stands at $38 million. We've submitted a bond request for $26.8 million, aimed to prioritize items such as smart beds, an automated pharmacy carousel, and community pharmacy construction. Slide 5. Complaints and grievances. We make strides here too, with total complaints decreasing by almost 20%. This progress suggests that our interventions are having a positive effect. Though grievances have seen a slight rise of 3.7%, we remain committed to addressing root causes to foster trust and confidence in our care. Slide 6. Actions underway. We are enhancing our person-centered care initiatives through targeted training. Our eye care training focuses on improving communication and service behaviors among our staff. We've implemented standardized scripts to manage patient expectations regarding wait time and expanded to the use of interpreters and translated materials to ensure patients fully understand their care. Additionally, we are improving our discharge communication protocols to ensure that patients clearly understand their follow-up care instructions. This is vital because it reduces the readmission and ensures that our patients have the resources they need for a successful recovery. Moreover, we have strengthened processes with the property office to safeguard patient belongings, which enhances trust and satisfaction. Slide 7, happenings and the impact within the community, highlighting our notable accomplishments from 2025 alongside the challenges we still face. We've received the Leapfrog Hospital Safety Grade of A, not once, but twice in the 2025 year. And US News and World Report recognizes our exceptional performance in diabetes care, heart arrhythmia, heart failure, and pneumonia. We also take pride in being the first in the nation to be designated as an AON Center for Excellence in Surgical Safety.
Excellent.
While these accolades speaks volumes of our dedication and hard work, they also remind us of the challenges that lie ahead. To enhance our behavioral health services, we secured funding to relocate and consolidate our programs into the Claire Schulman Pavilion. This will streamline and improve patient experiences in behavioral health. We are also launching a major public education campaign to increase awareness of chronic diseases and promote early cancer screening. Accomplishments and challenges go hand in hand. We have also we have achieved so much, yet there's always more work to be done to meet the needs of our growing community. Slide 8, acknowledgements. I want to take a moment to express my heartfelt gratitude to the CEO, Neil Moore, his leadership and fundamentals in steering the hospital towards excellence over the past 5 years. The partnerships we share between our CEO and the Community Advisory Board is invaluable. I also extend my thanks to our clinical and operational leadership and our government partners for their unwavering support in securing the resources necessary for us to deliver exceptional healthcare services. I want to thank you for listening to this report this evening. Together, we will continue to elevate the quality of the care at Queens Hospital and address the evolving needs of our community. We are open to any questions, any concerns, or any suggestions that you may have for Queens Hospital. Thank you.
Very good. Very good. Mr. Chair?
Very, very nice report. I wanted to ask you about the retail pharmacy and sort of like when was that opening and what is it that you expect that will be different from?
Absolutely. Before I answer that, let me first say thank you, Madam Chair Lady and members of the board for giving us this opportunity in sharing with you the work that is being done at Queens Hospital. The pharmacy initiative, it's a corporate initiative and we working collaboratively with members of the senior staff here in corporate to establish that. It's on the way, but it's a long way from being implemented. I don't have a date certain for implementation, but we've identified the location, this adequate space to put it, and we awaited because our current state where the pharmacy is located very tight. And so we're operating out of a very small space, but this will give us an opportunity to serve a larger volume of patients from the community as well as those who we currently have as patients that come to our hospital.
Thanks.
Very good.
Well, a couple of things, just to expand on what Neil is saying. So, the the outpatient pharmacies at almost all our hospitals are completely outdated. They're based on a 50-year-ago model. Don't take into account how many more medications people take now, how many more things are available, and the kinds of machinery that's necessary to provide safe prescriptions. It's not just like that the people don't like to be in the area too tight. It's that the equipment, the IT equipment, and the machines for filling bottles and the labels just can't be fit in. And so the first step in almost all of the retail pharmacies just has to be, we need a space that is built for outpatient pharmacy, which none of them were built for. They're all like some closet that was next to the inpatient pharmacy. But I also wanted to congratulate Queens and make sure everybody understands how extraordinary it is to get an A in leapfrog. That's work.
Yes.
And now that it's 2 years in a row, and you'll remember that Neil, when he returned, said he was on a journey to make Queens the best community hospital in the country. And 2 A's in a row is very good evidence that he is succeeding with his partners at that. So congratulations to Queens.
Sally?
Just your work in behavioral health is extraordinary. So the $70 million that you got to, I guess, expand your CPAP effort into the Claire Shulman Pavilion. What will that money be used for?
So it will be used for adding 2 floors to the pavilion building or an adjacent building to the pavilion, but it will be attached. The behavioral health program currently functions in 3 different areas. And what we would like to do is bring them all into one place so we can serve our behavioral health patients and not have them in 3 different areas.
Okay, thank you.
You're welcome.
Thank you. Doctor?
Thank you for a wonderful report.
Okay. Nita?
Thank you again for the wonderful report, and congratulations to you and your team on the really, high honor of the A 2 years in a row.
Thank you.
And let me say to Miss Robin,
Yes, ma'am.
thank you, Miss Robin.
Thank you.
Thank you for keeping it going, keeping Queens going.
I'm trying.
Okay.
We're proud.
So let me say to everyone before we close, Happy New Year's again. And let's keep up the good work. 2026, as we go to each year, it gets different. Sometimes it gets harder. But all the work that y'all are putting in it, all the care, I know we going to keep A's coming. So that is so important, and I'm looking forward to it. So let's keep the work going and keep Dr. Katzen, happy. So that way, and we gonna make sure that he's start with his team, and I know he gonna work Calethea hard to let's start trying to get this phone center. I'm with you.
All right.
I'm with you. So, any other new business? Hearing none. I now call a motion to adjourn this meeting. But before I adjourn, I always have to say, thank you, Debbie Brown. Thank you. Mafinte, is it Mafinte or McKinte?
Okay.
Tell him we miss him tonight, but y'all keep up the good work and keep the communication going. It's very important. And say to Calethea and Jadi, Calethea, thank you for all the hard work, because if it wasn't for you, I wouldn't be able to read and do all this stuff. No, but on a serious note, let's stay together and let's get it done. Against all odds, we ain't let nobody turn us around. We gonna keep on walking, keep on talking, all the way to H&H. Good night. Thank you for all the support, and please stay safe and well.
Summarized.